はい。
Ladies and gentlemen, as it is time, we'd like to start the press conference. Today, we'll be hearing about the COVID-19 vaccination program underway in Israel. We have with us the Chairman of National Experts Advisory Panel on COVID-19 Response and also Chief Innovation Officer of Clalit, one of the largest HMOs in Israel. The speaker will be Professor Balicer. You are aware that Israel has one of the most fastest-paced COVID-19 vaccination program underway in the world. Today we'll receive an update about the backdrop of this progress and the effect of the program at this juncture. And after which we'd like to engage in Q&A session with the audience. You'll be able, as to present your questions through the Q&A function. We'll accept questions at any time. The interpreters are Ms. Kaoru Ikeda and Ms. Mariko Uo. Thank you very much. Allow me to introduce myself. I'll be serving as the moderator today. My name is Nigel. I'm a member of the Special Planning Committee of National Press Club, and I'm a guest editorial writer for Kyodo. Before we listen to Dr. Balicer, we'd like to invite the ambassador of the State of Israel to Japan, Ambassador Yaffa Ben-Ari, for a few words. She was instrumental in realizing this program. Ambassador, the floor is yours, sir.
Hi, and a very good afternoon to you all here in Japan. I'm very proud and happy that the Japan National Press Club has organized this important briefing. Definitely, I wish to congratulate all the participants for joining into this session of sharing information. Basically, the embassy is doing a lot in sharing the very interesting and relevant information regarding the Israeli experience on the field of fast vaccination. In a way, I think you will hear I'm sure you will hear all the important information, but the fact is that we are trying in many platforms to share this info because we believe the Israeli experience can serve as a learning experience, and this information could be very important and vital for further fighting the pandemic in various countries, as well as with the pharmaceutical company, because what is happening now in Israel is a very first of its kind experience. Definitely, this campaign that we are trying to share this information is based on our initial initiative of collaboration between Israel and Japan. Here in Tokyo, we are trying to find ways to enhance this collaboration in many fields, not only in the medical field, but also on other issues. So in this framework of collaborating our information regarding the COVID-19 pandemic, definitely we are studying very carefully what is happening in Japan and how Japan is dealing with the impact of COVID-19 in many fields, in medical field, as well as in its economy. And definitely we try to learn from the management of the fight of COVID-19 in Japan as well, while different countries are using different mechanisms to safeguard the communities. We in Israel suffered 4 different lockdowns. You in Japan managed to leave the market open while trying to take other measures. To conclude, I would like to say that the collaboration between Israel and Japan have come to higher peaks, mainly in the economic field. And we've seen just a year ago how COVID-19 is blocking the freedom of movement between our countries, that was raised to the level that encouraged our national carrier to open a direct line between Tokyo and Tel Aviv. That particular opening was blocked back in March, exactly a year ago, March 2020, due to the pandemic. We believe that we can offer also ways to remove this blockage and open it back to movement through vaccination and the green passport that has been established in Israel. Green passport means, of course, all those vaccinated people. I have had the experience of being vaccinated. I came back from Israel 2 weeks ago. I'm still in isolation because I'm obedient to and I respect the Japanese instruction, but and with all the negative results of the PCR that I've taken both in Israel and here. And this is a case where you can learn from how to maybe open the door to a free movement of people in order to encourage your economy, not only in the touristic part, but also in raising level of investment and joint venture between our two communities and others as well, of course, all over. So I would really encourage you to look into that mechanism of the green passport and maybe find ways to respect it in order to bring together our economies back to some kind of maybe a new normal, but some kind of normal that will open it up for better economic growth and improved standard of living while fighting the pandemic. So with this in mind, I will conclude and congratulate all of you. And hopefully we all will stay safe and have a much better, living condition in the near future. Thank you very much.
Your Excellency, thank you so much for setting aside your time out of your busy schedule. So, Professor Balicer, if you're ready, please take the floor. Please go ahead. Thank you.
Okay. Thank you so much, ladies and gentlemen, esteemed colleagues. It is a pleasure and a privilege for me to be speaking with you today and share with you some of our experience and know-how. I will now share a presentation. There will be a lot of time for questions and answers. So I will go briefly on the topic. In my single visit in Japan, I have gained tremendous respect to the achievements, local technology and healthcare setting in Japan, and I am really looking forward to future collaborations as well. Let me see if the presentation is now up. Just 1 second. Yes. So I hope you can see the presentation now, and here we begin. So ladies and gentlemen, we will talk today briefly about pandemic mitigation through vaccination and Israel as a case study country. My name is Balicer. I'm a physician and a scientist. I serve as Chief Innovation Officer and the head of the Research Institute at Clalit, Israel's largest healthcare organization, responsible for the care of over 50% of the Israeli population, about 4.7 million people, usually from cradle to grave throughout the lifespan, primary care, specialty care, hospital care, all under one roof. In parallel, I serve as the chairman of the Israeli National Expert Advisory Panel on COVID-19 response. Now, when this pandemic had started in March 2020, we have, at least I have, tried to predict what this pandemic might look like. And I said it all depends on how strongly we confront the threat. And I said there is one option that our mortality rates would look like the red graph, that would say that without full lockdown at the very beginning, we might have a lot of surplus mortality and something that might bring our hospitals to their capacity. Or if we have strong lockdowns and we have a gradual process, we will have several waves of infection and severe morbidity, hopefully that we will be able to control through various types of interventions. So this was the prediction. And this is the actual disease trends in Israel in this time period. So this is the prediction and this is the outcome. I got to tell you that we were quite on spot. And we will not talk today, not about the first wave and not about the second wave. We'll talk about the third wave that we are now exiting and what we are doing about that. So Israel is now through the last phases of the third wave of infection. And this third wave was impacted by two key factors. One is the great dissemination of the B117 UK Kent variant, which has become, by the middle of the vaccination campaign, 90% of the daily infections in Israel. And in parallel, so that was pushing infection and severe morbidity up. And in parallel, there was the vaccination campaign that pushed the morbidity and severe infection down. And so these two, it was a race between these two factors to say how this third wave will end up. Will it look more like what happened in the UK or in Brazil, or will it look something that's similar to other countries? And so What we have by now is we have about 60% of our population vaccinated. That's all ages. And we have 50% of our population fully vaccinated, which means they went through the 2 doses of the vaccine and 1 week more. That makes them protected. So this is where we are right now in terms of the vaccination campaign. And so some countries ask, how did we get to vaccinate so many people in such a short amount of time? So we'll talk about that too. So we started vaccinating on December 19, 2020. This is not 2021, it's 2020. We had almost 10 million doses already provided, over 5 million people vaccinated, and over 4 million people fully protected. And when we look about the over age of 50, it's 80% of the population that have been vaccinated with 2 doses and are now fully protected. So when you will see the decline in cases and in severe cases, the high protection rates of the elderly play a major role in that. So how did we vaccinate so many people? First of all, you need to remember it is not fair to compare Israel to any a large country like Japan or like Germany or the United States, because we are a young country. We are geographically condensed, and that gives us a lot of benefits when we are aiming to create a vaccination plan. And so the distribution chains were much easier in a small condensed country, and vaccinating all of the elderly is easier when you have such a low percent of elderly population. So that's a markedly different challenge than Japan, for instance, when it comes to Israel, and we have to remember that. But within that, there's still a big challenge how to create, and we have basically created almost overnight hundreds of vaccination clinics all throughout the countries. Those vaccination clinics were opened by the health organizations, by the HMOs. They were opened in different places, as you can see here in the picture, in basketball halls, in exposition centers, and in very large clinics. And these are very large areas with administration place where you bring your card, you swipe it, all of your digital data already is on the computer, and you immediately go to one of these vaccination booths you see here in the slide. There were, as I said, hundreds of such places opened within a week through the entire country. So you can see here how this might look like. So there's an administration desk here in the upper right quadrant, and then you go into those booths of vaccination where there's a nurse in each one. You go in, you get the vaccine from a nurse, you get out, it's done within a minute. And then you go outside. Here are another examples. And over the left lower corner, you see in the main square of Tel Aviv, like the main square, you see a tent. And in this tent, there was a vaccination area, and people have been just vaccinating throughout. Okay. So the second point that I want to mention is the issue of digital health. It really helped to have all of our data digitized. So Israel has had electronic health records for over 2 decades now, and everything is digitized. So when we wanted to do the outreach, then the health organizations like Clalit that vaccinated the majority of people in Israel, it was easy to know who needs to get vaccinated, to send them reminders through digital health, and they had their apps, their applications, by which they could just schedule an appointment with a vaccination clinic. And once they came into the first dose, an immediate revaccination plan was already in the schedule digitally for them. For the population that was older and was not digital, we had call centers that called the elderly and made sure they have an appointment. So it's a combination of high and low tech all at once. Another thing that we did to make things simple, although we had the capacity to identify populations at unique risk, we did not go through this gradual process, but instead we went for age-dependent vaccination campaign, and we started with the 60 years and older. And once we've exhausted vaccinating all of the 60 years and older and the healthcare professionals, it took us several weeks, and only then we opened for 50-year-olds and teachers, school teachers, and then we opened for 40-year-olds. And from that point, it went until right now, anybody above the age of 16 can get vaccinated. So this simplified vaccination categories was very helpful for us. Another thing that's very important is the operational agility. We made sure that the nurses and the administrators in all of these vaccination campaigns had the authority to vaccinate anyone they wanted. If you come to the end of the day and there's leftover vaccine that will get bad if you don't use it because of the refrigeration, then they were allowed to vaccinate anyone. So at the end of the day, if they had 9 doses left over or 90, so they went outside and they just brought people in, any age group, and just vaccinated them to make sure we don't waste. And indeed, less than 0.1% of the doses were wasted because we couldn't vaccinate the right people. Now, there's always the issue of vaccine hesitancy. And some people are hesitant on whether or not they want to get vaccinated. And so we tackled this with several approaches. One was by leading by example. So this picture shows the president of Israel getting vaccinated in front of the camera. Same was the prime minister, same was key physicians. I was vaccinated in the first day live in front of the camera to show that we are sure that the vaccine is safe and effective. Besides that, there's the issue of transparency. And we have tried to convey a very clear message that said that about what we know, we say we know, and what we don't know, we say we don't know. So we didn't try to hide anything about the vaccination, the thing that we don't know. We said, for instance, what will be the side effects 2 and 3 years? We said, we don't know. We only have follow-up for several months. What we do know is that this is what we know from the clinical studies, and we know that the risks of COVID-19, the disease itself, are very high. And when we compare the unknown risks of a vaccine and the known risks of the disease, it makes sense to choose to get the vaccination. And that was very well accepted in the public. And indeed, over 80%, basically almost of those who are eligible have already been vaccinated. And we have less than 1 million people that are eligible and were not vaccinated. Finally, we had a lot of culturally adapted outreach. So when we wanted to approach small population subgroups that require special attention, we had a dedicated effort. For example, this is a lesson, a rabbinical lesson for the ultra-Orthodox Jews in Bnei Brak, which I participate in, and I was explaining to them everything I knew about why the vaccine is safe and effective. And 2.5 hours of discussion, they grilled me on questions and answers about safety and efficacy. And at the end, the chief rabbi there said, okay, I'm convinced. And there was a rabbinical verdict that called everyone to get vaccinated. We did this with local community leaders, with qadis and imams in the mosques as well, for the Arab-speaking population in different languages and in different subgroups, and that was very helpful in getting the vaccination out. So the last point I want to touch upon is how well do vaccines work? And for the question, how well do vaccines work? Since we were the fastest vaccinating country in the world, we could get real world, and we had a lot of real world data, digital data, we could answer this question. And so what I will show you now is the results of a study that was published in the New England Journal of Medicine several weeks ago. And this was a study done in collaboration. The Clalit Research Institute, which I am the chair of, was the key organization but we had wonderful collaboration with researchers in Harvard, Miguel Hernan, Mark Lipsitch, and Ben Rice, amazing scholars that have taken great part in making this happen. So this is based on Clalit data, that, as I said, is the biggest payer and provider system in the country that's been digitized for over 20 years. So to remind us, in the clinical trial of the Pfizer vaccines, which is the only vaccine right now used in Israel, the Pfizer-BioNTech vaccine, the clinical trial that was published when this was approved by the FDA said there was 95% effectiveness for symptomatic infection. In our study, we have been able to show that in Israel, there was a 94% reduction in symptomatic infections in a study that was very advanced. What we did, we took 600,000 vaccinated individuals and compared them with 600,000 unvaccinated individuals that were matched 1-to-1. For instance, for any individual, 56-year-old male, ultra-Orthodox from a certain neighborhood in Tel Aviv that had 3 comorbidities and was getting flu vaccination for 2 years, that was vaccinated, we matched him with a 56-year-old male from the same neighborhood in Tel Aviv, also ultra-Orthodox, with 3 comorbidities and vaccinations in the last 2 years. It was that level of matching. So with this matching, we could show this 94% reduction and 92% reduction in severe illness. So this was really a big deal in that point, to show that severe disease is reduced by 92%. And that was very, very significant. In the study, you can read our results. We could also show reduction in mortality, and also we shown reduction in documented infections and asymptomatic infection, but we cautioned that this is not a full assessment of the transmission reduction because there wasn't an ongoing daily outreach to test each and one. This is a separate study that we're doing now and it was not yet published. So this is some of our outcomes from the study, 92% reduction in severe illness and a reduction in mortality that is similar as well. This study gained a lot of attention. You can see here, it is one of the most popular studies in social media ever. You can see here it's within the first 75 most popular studies ever from the 17 million studies that are under observation. And thanks to these studies, we could put life back in order in Israel. So as we got the outcomes of this, results, we were at the end of the lockdown, and we decided to lift the lockdown despite the fact that morbidity was not going down. But we took the leap of faith, we trusted the vaccines, we opened the economy, and indeed morbidity went down despite opening the economy. The third stage of opening happened again despite stagnation, but we did open the economy even more with green badges, and the morbidity keeps on going down despite this opening up. Now, I will mention that when we opened up the economy, we use what we call the green badges. So it's an app on your cellular where basically what you do is that you can show that you have been vaccinated and you are protected. And by showing that, you can enter high-risk settings like restaurants, indoor restaurants, or culture shows with a lot of people in the same hall. So this is very effective in creating safe settings and opening the economy. Now, in parallel, those who chose not to get vaccinated can go to a restaurant, but not within the high risk, not within the indoor setting, but in the outside, as you can see here, with a different set of rules, and that's still working. So you can keep the equity while protecting the population. Indeed, the vaccines are very effective. We can see the dramatic reduction in the severe morbidity. And the dramatic reduction is seen first in the elderly over 60 that were vaccinated first, and only then in the younger age groups that were vaccinated later. So what we've seen in the last 15 minutes basically was a very quick overview of the Israeli vaccination campaign, what it was, the impact it was on our decision to open the economy and seize all the lockdowns, despite at some points a lack of reduction in the morbidity, but this paid out well, and we still see a continuous reduction in the total morbidity, and we are very happy with these results. And we hope that our experience would serve Japan in its decision-making process on when to vaccinate, who to vaccinate, and how to vaccinate. And we always stand ready to share more know-how and knowledge and learn from the Japanese experience and know-how in parallel, and increase basically the collaboration between the two countries. And with that, I will adjourn. Thank you very much for your attention to this point. You're on mute, so we can't hear.
Excuse me.
Thank you very much. Professor Balicer, thank you for this most informative presentation. So we would now like to receive questions from all the journalists who are taking part in this program today. So we're looking forward to the Q&A session. Allow me to ask a very basic question. I apologize for this very basic, naive question. You are with Clalit. It's an HMO, isn't it? What type of a nature? Can you explain to us what this is all about? Is it private sector or is it a public organization? Can you explain to us about your Clalit, please?
Sure. Thank you for this question. I should have spent more time looking into it. Israel has a universal healthcare rule, which means that every citizen is covered by the government and is insured by the government, paid by taxpayer money, and is allowed to get a wide basket of services. And every citizen can choose between 4 organizations that they can take these services from. These organizations called sick funds or HMOs are public organizations, non-for-profit, that get their money from the government and use it to provide primary and specialty care. And in the case of Clalit, which is the largest one, primary care, specialty care, and hospital care to its entire population, and is usually people who are members of Clalit are usually members from very young age, from birth, and usually until very late age, until basically death at 80-something years old. And we provide them with all of these services. And so Clalit is not only a very large health organization, it's a very large organization in local terms. It is the biggest employer in the country of any industry. So it's a very big organization.
Thank you very much for that response. Appreciate it. So let us now take questions from the audience. So let me see. This is from Yomiuri Shimbun, medical team. Mr. Tsuchida has a question. Oh, sorry, I should pronounce his name. It's Tsujita-san, Mr. Tsujita. I understand that the vaccination program has gone very well in Israel. Why is it that the vaccination program has been so successful in Israel? I understand that mild symptoms such as fevers and fatigue seem to be more prevalent compared to other vaccines. Isn't there a sense of hesitancy among the people to receive COVID-19 vaccine? Thank you.
Okay.
Thank you for this question. So as I've tried to allude, vaccine hesitancy exists in every country and in Israel as well. And if you want to deal with vaccine hesitancy, you have to have a plan, a very wide national plan to provide timely information and to give it to different population in a culturally adapted approach that is easily understandable to them. And you need to work so what we've done in Israel was work in several different paths. One, we had a national campaign to explain the importance of the vaccination by different key figures that came on ads on TV and on social media and explained the importance of the vaccine and what we know about the side effects and what we know about effectiveness. In parallel, we have had specific work with specific communities, with community leaders, to explain to them and from them to trickle the information down, it would reach every different person. We had a lot of transparency in communicating what we know, and we had a lot of local evidence created in Israel that was shown in graphs and in numbers to the population so they can see the effect of the vaccination and they can get persuaded that they want to take part in it, and it worked very well. Also, the green badge approach that said that people with protected by the vaccine are allowed to go into high-risk settings like closed indoor settings of eating and of culture and of all of that is also a good push for people to go and get vaccinated. So all of this together has created really a huge flux of people who want to get vaccinated, and by now vast majority of the people who are eligible above the age of 16 were vaccinated, over 80%, which is fantastic.
Thank you very much, sir. So let's go on to the next question from an individual member of the press club. Harada-san is the name. Harada-san asks a very direct question. Why is it that Israel was able to procure vaccines so quickly? Thank you.
So I am a member of the experts advisory team. I'm a scientist. I am not a Ministry of Health official working on procurement. So I'm not exposed to all of the different aspects of how vaccines were procured. From what I know, before December, Israel had several advanced purchase agreements with different providers and paid to get an option in case they will have a vaccine, so it will come to Israel. So that was one aspect. The other aspect is that once the beginning of the events became clear, Israel worked very early with Pfizer and other providers to strike deals and to pay to get a lot of vaccines first. And also, it has vouched to share not individual data, but aggregated data on the successfulness of the vaccination campaign with the world, with the vaccine companies, but with the world in general, and the knowledge of the companies that Israel would release all this data and would have such studies like the one you see in the New England Journal of Medicine available, increased the interest in getting more vaccines into the country, so it will serve as a testing bed to show the world if it's effective or not to get a large mass vaccination campaign. So this is my understanding, but I'm not involved in the procurement.
Thank you very much for that response. Appreciate it. So I would like to ask a relevant question for myself. The CEO of Pfizer and President Netanyahu, it's well known in Japan that they're very close. Is this true or not? And it's a difficult question for you to respond to, but are they close, the CEO of Pfizer and President Netanyahu?
This is not a question that a scientist can answer better than a journalist. So I'm not in a position to answer this question.
Thank you very much. Point taken, sir. So let's go on to the next question from Mainichi Shimbun Yokota-san, Mainichi Shimbun newspaper. In Israel, vaccination has been very high. But what about the period of sustainability of antibody? How long can the antibody be sustained? And what are your thoughts about the need for the second dose? Thank you.
So our study that was published in the New England Journal of Medicine has been able to demonstrate that the first dose, in the first weeks after the first dose, only confers partial protection against morbidity and severe morbidity. And 1 week after the second dose, there's a much larger, a huge effect of protection. However, since in Israel, almost all of the people get the second vaccine dose in time, we do not have a way to be able to tell whether or not people who do not get the second dose are getting their protection continuously improving or not. What we can show is that per protocol, 2 doses plus 1 week, exceedingly effective. And this is our approach in general, so we didn't have to deal with a 1-dose regimen. In terms of how long will the antibodies last, nobody knows that now. We need to continue the follow-up in the coming months and years, and we are doing that. And every time period, we will release additional data on the protection, 3 months, 6 months into the vaccination to tell you if and how well this immunity is maintained.
Thank you very much. Next question. Waki-san, an individual member of and also Asahi Shimbun. Japan is struggling to procure vaccines in Japan. Are there measures that could be taken by the Japanese government? This is a question from Asahi Shimbun. It's not a very scientific question, but any insights, sir? It's a policy-related question, a very difficult question for you. We understand, but any insights?
Insights on procurement? I'm sorry, but I'm not the right person to give advice on how to procure vaccines.
Thank you very much. Point taken. Now we have some questions submitted in English, and I will have the interpreter to read out the question. So the interpreter, I will read out the question. So let's go on to a question by Miyoshi-san from Yomiuri Shimbun newspaper.
Yes.
So this is the question from Mr. Miyoshi of Yomiuri Shimbun newspaper. It reads, Israel is one of the leaders of the vaccine implementation in the world. But does Israel face any criticism or resentment by other countries due to monopoly on the vaccine? Additionally, I would like to ask you to ensure the fairness of vaccine implementation in the world, including developing countries.
So Israel is a country, and the vaccines that it procured until now is a very small drop in the ocean of the vaccines produced to date. So the availability of, to my understanding, the availability of vaccines in Israel do not impact its availability in other countries because of the size of the country. So another 1 million doses in Israel has negligible effect on the global availability of vaccines. And again, the issue of the international community making great strides to make sure that there's a wide distribution and equitable distribution of vaccines throughout the world. I think that it is important to have such efforts successful and have as many vaccines available to all countries, those that are in countries that are more affluent, as well as in countries that are less affluent and require more help in procurement of these vaccines.
Thank you very much. Thank you. Next question. This is from Sanken Shimbun newspaper, Sato-san. Based on the findings of Pfizer, people above the age of 70 years old, if you have any data about people above the age of 75 for which Pfizer does not have a lot of subset of data, what about the efficacy of people above the age of 75? Thank you.
Thank you for this question. Because in our study, we had 600,000 vaccinated and 600,000 non-vaccinated, so it was much, much larger, several tens of times than the original clinical trial. We did look at older age groups, and our data, as you can see in the paper, I refer you to the paper, we have shown that even among the elderly population, above 70, above 75, the vaccine is very effective, as effective as in younger people, and we were very encouraged by these results. So the answer is yes, the vaccine is effective in the very old.
Thank you very much for that response. From Nihon Keizai Shimbun, Ando-san, another question from Ando-san. This is related to the previous question, I understand, but about the you're not yet sure how long the antibody can last. Now, against the backdrop, you're already introducing green badge, and you're actually allowing people to go to high-risk places based on the green badge, despite the fact that the antibodies, the period may not be very clear. So what are your thoughts? Thank you.
So we do know that the vaccine is very effective in preventing documented infection, over 90%. And since that, we understand that people who have been fully vaccinated that come into a green badge setting like a restaurant have a much, much reduced likelihood of both contracting and having an illness, and probably severe illness. So because we want to have, on one hand, regaining of the economy and the way the economy can regain what we need. And on the other hand, once you got a 10-fold reduction in the overall risk, and in some cases even 20-fold reduction, then this is enough to allow yourself, in the situation we are right now, to have a green badge setting working and allow the people to actually come and take part in those activities. And yes, there is a residual risk in every such person despite the vaccine, but the residual risk is small, and the need for the economy to open is significant. And so this, I think, is a good balance between the needs of the economy versus the overall needs of public health. And I think we're striking a good balance. and the continuous reduction in the numbers that we've seen in the last 2 weeks after the third easing of the restrictions probably serves to show that we were not mistaken.
Thank you very much. Another question from NHK, Yamamasa-san from NHK Broadcast. This again is on a similar topic, I understand. In Israel, you're talking about vaccination passport. You have already launched the vaccination passport. Have there been any discussion about the possible impact of this passport? And how do the public understand the efficacy of the passport? So I suppose it's related to the green badge question earlier. What about the passport? Thank you.
You're welcome. So yes, indeed, we do understand that the green passport is the key component of our exit strategy. And we have been able to communicate to the public very well on how this actually works and what is the logic behind it. And the public is very acceptable to this approach and is generally very supportive of it. It allows people who might be elderly and still have residual risk to take part in cultural and other activities, minimizing the risk, but not isolating them completely from social interaction. So I think we're striking a good balance, and I think the public in general is appreciative of this approach.
Hi.
Thank you for your response. So we'd like to go on to the question in English. This is a question from Mr. Tomaru, freelance. Please bear with me. I will first interpret in Japanese and then go on to English. 'The question is, you said about 60% of the population are being vaccinated, which is remarkable. What are the possible positive impacts in terms of the social and cultural aspects on top of the medical effect? Thank you. That's the question.
Okay. So regaining life is critical in many aspects of the public health and well-being. The availability of social interactions are critical for the mental and physical health of every person, especially among the elderly. And the fact that we can get families back together, we can have grandparents meet their grandchildren, we can have people go back to social interactions and take part in activities, really dramatically improves both their mental health and their physical health. The fact that people do not postpone any medical procedures or are not hesitant to go ahead and receive medical care is critical to prevent deferring important chronic disease management. And so we believe that, putting this life back on tracks is critical for public health and for public well-being, as well as for healthcare of the entire population, and is striking a good balance.
Thank you very much. I would like to ask a question as the moderator, again, if I may. In the beginning, you mentioned that 60% of the population has already received the first dose, and 50% of the public has already received the second dose. So that's a remarkable vaccination program. But when it comes to herd immunity, is this already achieved, do you think? What are your thoughts about the herd immunity? I would appreciate it, Doctor.
Thank you. So herd immunity is a very high threshold where because of the extremely high immunity rate in a population, the disease cannot disseminate because the effective reproductive number is 1 or lower. This is a very high threshold and extremely difficult to attain in this disease, which has a fairly high R0, and it requires vaccinating a vast majority of the population, including the kids. And since we do not vaccinate kids yet because there's no clinical trial, then we probably have not reached anything close to herd immunity. However, we do see very strong, I think, indirect effects of the vaccine. Now that 50% of the population is protected, the protected population is in practice an epidemiological barrier that prevents people from infecting each other. And so one of the reasons that we now have a basic effective reproductive number of 0.6, which is very low, and the disease is really moving down very quickly. And that is the case despite the economy being open, could only be the effect of indirect protection conferred by those vaccinated on those not yet vaccinated. And so herd immunity, not yet. Indirect protection, very much so.
Thank you very much for that. You talked about 0.6. Is this the most recent number for Israel as a whole? 0.6. Is that the most recent number for Israel as a whole?
So the most recent number on the R, let me tell you the current data, is 0.59 from this morning. 0.59 or 0.6. So yes, and that means that the daily number of new cases is declining every day. So we went below, for now 3 or 4 days in a row, below 1,000 cases per day. We used to be in 9,000 in January. So we're less than 1,000 per day, and the numbers keep going down. So this is a good sign, and this is happening when everything is open. Restaurants are open, culture is open, concerts, rock concerts are happening. Election day happened yesterday. So it is very, very reassuring. But the risk always exists.
Thank you. Very clear. So let us go on. There's other questions. Earlier, you talked about the vaccination, about the smooth implementation of the vaccination. You mentioned the usage of electronic medical cards. In Israel, in what manner and at what time did you introduce the medical records in Israel, electronic medical records in Israel? Thank you.
So electronic medical records were introduced in Israel in the mid to late 90s. So that's about 20, 25 years ago. For the last 20 years, we had electronic medical records in all of the community, and the last 15 years, hospitals as well. And so right now in Clalit, we have, many years of backdrop of electronic data on everything: inpatient, outpatient, labs, drugs, imaging. It's all digital, and it's all with strong access. And we use this access also during the pandemic, not only for the vaccination campaign, but also to provide directed care through applications and predictive medicine, with a lot of predictive medicine done in this. So the Clalit Research Institute, for instance, created a predictive model of patients at risk of deteriorating, and we have had very pinpointed effort to call them and to do things with them based on this predictive modeling, for instance. So this is the long answer.
Thank you so much. So let us go on to the next question. This is Yomiuri Shimbun Yamaguchi-san, Yomiuri Shimbun newspaper in Israel. You are a top leader in terms of the development of medical equipment. That is my impression. When it comes to COVID-19, what are your thoughts about the development of international vaccines for COVID-19? What are the possibilities for developing international vaccines for COVID-19? That seems to be the question.
What do you mean by international vaccines? I'm sorry, something in the translation went wrong.
Correction, I should have said domestic. I'm sorry, so Israeli-made vaccine. He said international. It's supposed to be domestic production of vaccines. Thank you.
You're welcome. So, Israel is seriously considering creating local capability of producing its own vaccines. We already have at least one candidate vaccine that was developed in Israel and is in clinical trial. But I think that Israel should strive to have a manufacturing facility as well as the development of the vaccine candidates. And this is something to think about in the coming years and the potential avenue of collaboration.
はい、ありがとうございます。続けて読売新聞の本間さんのお尋ねです。先ほど集団免疫のご説明もありましたけれども、ワクチン接種が進んで、接種率が進んで、何%ぐらいになった頃から効果が。
We talked about the herd immunity. At what point did you believe the vaccination is underway? You mentioned R not being 0.6, but how far, at what percentage of vaccination do you believe that the effect of vaccination could be felt? In the context of herd immunity, what is the percentage of vaccination that is required to make you feel that this has been effective? Thank you.
It is very difficult to answer. It depends on many factors. It depends on this variant that you have in your country at the time, because different variants have different reproductive numbers. And the current variant that we have, B117, is highly infectious and therefore takes the threshold of herd immunity up. It depends on whether or not your vaccination campaign is evenly sparse within the community, or there are areas of less vaccination. So such areas can actually hurt the herd immunity approach and have dissemination despite high coverage. It also depends on whether or not people continue using masks and social distancing, so that change the effective reproductive number. So this is a very complex question to answer. The only thing I can say is that I truly believe that without vaccinating the kids, we will not be able to reach herd immunity.
Thank you. That's a very valuable insight. Thank you so much. This is also another question from the same person, Honma-san from Yomiuri Shimbun newspaper. We talked about the variant earlier. You talked about the variant strains earlier. Can you talk about how widespread the variant strains are in Israel right now? Here in Japan, the experts are now saying that going forward, the variant strains will be the predominant virus going forward. What is the situation in Israel?
Since January 2021, 90% approximately of the newly infections in Israel are from the variant B117, the UK Kent strain. From recent data that we have, we know that also the South African variant exists in Israel, and about 1% of the new infections are caused by that specific strain. Other strain, there might have been just point assessment, but they are not prevalent in the country.
Thank you very much. I'd like to go back to my previous question. Earlier, you talked about the priority groups for vaccination. People above the age of 60, or people who are in the medical profession, and people who are vulnerable, people who have pre-existing conditions, and so forth. In the case of Japan, we are beginning with senior citizens, medical profession, and then going to people with preconditions and people with... so that is the order of the vaccination going forward for Japan. In the case of Israel, are these priority groups, did they receive vaccination all at the same time or in different orders? Can you talk about the order of the priority groups in terms of receiving vaccinations in Israel? Thank you.
So at the beginning of our campaign, we vaccinated those above the age of 60 and healthcare professionals. After that group was exhausted, we moved to above 50 and high school and school teachers. And after that was exhausted, we moved to 40 years and older. And after that, at some point, it rapidly winded down to opening for everybody above the 40 years and older and high school between the age of 16 and 18. And then we opened it for anybody above the age of 18.
Thank you. Very clear. So people above the age of 60 and those in the medical profession received the vaccination at the same time in the initial stage. Is that the case?
Yes, healthcare professionals and elderly together, same time.
Thank you very much. I'm afraid we are running out of time. With regard to COVAX, what is the level of cooperation rendered from Israel to COVAX? I know this is a policy question, but if you have any knowledge about the Israel policy vis-a-vis COVAX, thank you.
No, I don't. I'm sorry.
わかりました。はい。
Point taken. Thank you very much. Well, ladies and gentlemen, I'm afraid we're coming close. Oh, my apologies. Please bear with me just for a little while. Please bear with me.
少々お待ちください。
Please bear with me. I would appreciate your patience for a little while longer. Thank you. My apologies, sir. We have received a question from Ando-san from Nikkei newspaper once again. I would apologize if I had missed it. But what about the vaccination for pregnant women? What about the vaccination program for pregnant women? Do you believe that there are any risks or not? Thank you.
So, at some point, after some experience was already available, the recommendation of the Israeli Society for OBGYN was to vaccinate pregnant women on the trimester third and then second. And this is currently still the advice because we know that the risk of COVID in late-stage pregnancy is higher. And we had some unfortunate events of pregnant women dying of COVID-19 and a lot of demand. So we allow pregnant women to get vaccinated, and we keep on a watching eye to make sure about potential adverse events, etc. And the data is continuously collected, and I haven't seen until now any report of a signal of any problem with that, but it requires a proper study to do this assessment and publish it in a peer-reviewed journal.
Thank you very much. One more question, if I may. This is from an individual member. Matsushita-san is the name. The question is as follows. You're talking about vaccination for children. Are there any plans to start vaccination for children? I think you mentioned that the vaccination is in progress for people under the age of 16. I think the questioner wants to ask about very small children. So what about vaccination for small children, very small children? Thank you.
The vaccination in Israel is happening per the clinical trials. And the clinical trials are above the age of 16. Therefore, we only vaccinate above the age of 16. When new studies will come out with clear evidence of safety and effectiveness among younger age groups, we will vaccinate younger age groups. Until then, that is not part of our policy.
はい、わかりました。
Very clear. Thank you. Yes, I should have asked that question myself as the moderator. So I think it's time to wrap up the session. I'm afraid we were not able to read out all the questions. I do apologize to the audience, but I think our time has come. Dr. Balicer, thank you so much for your valuable insight. Earlier, as the ambassador mentioned, the cooperation between Japan and Israel is very important, and she mentioned that she will continue to monitor the level of cooperation. So thank you so much for your contribution today. With this, we'd like to conclude the press conference. Thank you so much, ladies and gentlemen.